Hi there, welcome to my channel. Today we are talking about immunotherapy. Immunotherapy is a relatively recent cancer treatment modality that is revolutionizing how cancer is treated. Let's get started. Our immune system acts as an army, protecting the body from harmful invaders like viruses and bacteria. Among its key soldiers are T cells and B cells. T cells directly attack invaders, while B cells produce antibodies to neutralize them. These immune cells are also capable of recognizing and eliminating cancer cells, which they treat as abnormal or foreign. Each cell in our body contains proteins essential for its function. These proteins are broken into smaller pieces called peptides, which are displayed on the cell surface by molecules called major histocompatibility complex or HLA. T cells use their T cell receptor, TCR, to scan these peptides, much like a barcode scanner. If the peptides appear normal, the T cells move on. But if they detect abnormal peptides, such as those from mutated proteins in cancer cells, the T cells activate, releasing chemicals and proteins to destroy the cancerous cells. However, cancer has developed ways to evade the immune system. Tumors can block T cell activity by producing inhibitory molecules like PD-1 and CTLA-4, or by converting T cells into suppressive T regulatory cells, which help tumors grow by weakening other T cells. Immunotherapy has emerged as a game changer in cancer treatment by enhancing the immune system's ability to fight tumors. It works in two ways: strengthening the immune system and overcoming the defenses set up by cancer. Now, key strategies include: number 1, cancer vaccines. These train T cells to target mutated proteins from tumors or neoantigens. They work similar to how flu vaccines prepare the body to fight the flu virus. Next is adoptive T cell transfer. In this, T cells are extracted from the patient, grown and strengthened in a lab, and reintroduced into the patient's body to fight the tumor more effectively. This is also known as CAR-T cell therapy. Next is cytokine therapy. Proteins like interleukins 2, 7, 12, and 15 stimulate T cell growth and activity. Agonist antibodies, which include antibodies such as anti-OX40, anti-GITR, and anti-41BB, help T cells grow stronger and more aggressive against cancer. Immunotherapy also targets tumor defenses by using immune checkpoint inhibitors, a widely used and FDA-approved treatment. These drugs, such as anti-PD-1 and anti-CTLA-4, block inhibitory molecules on tumor cells, removing the stop signals that prevent T cells from attacking. Now, common examples of checkpoint inhibitors include pembrolizumab and nivolumab, among the others, which help to restore the immune system's ability to fight cancer effectively. While immunotherapy has shown remarkable success, it can have side effects that require careful monitoring by physicians. Though rare, these side effects can be severe if not treated promptly, but they are usually manageable when addressed early. Immunotherapy represents one of the most significant breakthroughs in medicine, offering hope for treating cancer more effectively than ever before. In a groundbreaking clinical trial led by Dr. Heather MacArthur at UT Southwestern, researchers used cryoablation to treat breast cancer by freezing the tumor inside the body, creating an ice ball. Preclinical studies suggest that freezing tumors can stimulate the immune system to remember how to fight cancer cells. After the frozen tumor was surgically removed, its size had significantly reduced, offering promising results. One compelling example is former US President Jimmy Carter, who was diagnosed in 2015 with metastatic melanoma that had spread to his liver and brain, a stage once considered terminal. Thanks to immunotherapy, he lived for another 10 years, underscoring its potential to transform cancer care. The history of immunotherapy reflects decades of scientific perseverance. Dr. William Coley, often called the father of immunotherapy, observed in the early 1900s that cancer patients with infections sometimes experience tumor regression. Inspired by this, he developed Coley's toxins, a mixture of dead bacterial cells injected into tumors to stimulate the immune system. Though not widely adopted, His work laid the foundation for modern immunotherapy. The first immune checkpoint inhibitor, ipilimumab, was approved in 2011. However, the target for this drug, CTLA-4, was identified in 1987, and its potential was demonstrated by Dr. Jim Allison in 1995. This 24-year journey highlights the iterative nature of science. Transforming discoveries into life-saving treatments takes time and persistence. While immunotherapy offers hope, it has limitations. These therapies may cause side effects that require careful monitoring by the treating physician. Removing stop signals from immune cells can sometimes lead to autoimmune-like side effects, as the immune system may attack healthy cells. Common side effects include rashes, diarrhea, liver injury, thyroid issues, joint inflammation, and in rare cases, heart or nerve damage. While uncommon, some side effects can be serious or even life-threatening if left untreated. Despite these risks, most side effects are manageable, and physicians carefully assess each patient's suitability for treatment. Initially, patients with autoimmune diseases were excluded from immunotherapy due to safety concerns. However, as research advances, clinicians are exploring ways to safely expand its use. Immunotherapy doesn't work for everyone. 60 to 80% of patients with cancers like breast, prostate, pancreatic, or testicular cancer may not respond. Improving its accuracy involves tailoring treatments to individual patients. Recent breakthroughs in breast cancer research have uncovered the complexity of tumors. Traditionally, breast cancer was classified into three main types: hormone receptor positive, HER2 positive, and triple negative. However, scientists have discovered intra-tumor heterogeneity, meaning a single tumor can consist of 10 distinct subtypes. By analyzing the subtypes and measuring how the immune system responds to each subtype, researchers can now classify breast cancer with unprecedented precision. This enables the development of individualized immunotherapies that activate a patient's immune system to target their specific tumor makeup, paving the way for more effective treatments. Immunotherapy is a revolutionary field that combines scientific innovation with personalized medicine. The future of immunotherapy lies in combining various approaches to achieve two key goals. Firstly, to build a trained army of immune cells to attack cancer, and secondly, dismantling the cancer's defenses by empowering the body's own immune response. These strategies aim to enhance the already remarkable outcomes that immunotherapy is delivering to patients. Although challenges remain, its potential to transform cancer treatment is unparalleled. Thank you for taking the time to explore this exciting frontier in healthcare. Please like, share, and subscribe if you enjoy my content. Bye for now, and I'll see you in my next video.